eyes are the canvas of the soul. But what happens when this canvas is tainted by a grave illness, leaving brushstrokes of darkness? Good afternoon, lovely listeners. It's time again for your favorite show on radio. Yes, talking about eyes on the road. Yes, and today we'll thyroid eye disease, also known as Graves' ophthalmopathy. Yes, quite a mouthful, and the effects it can have on the quality of your life. So, for those who are ardent listeners, you see, this is a new topic that I definitely want you to be part of and to learn. Yes, of course, our doctor will be taking us to the classroom. Now, a bit of background information. Every year, 16 in 1,000 women and 3 in 100,000 men are diagnosed with thyroid eye disease. And this is quite an alarming statistic. And as a result, it's important to have this discussion today. Trust that once again we'll be ready to provide you with the measures you can take to protect yourself from the dangers of thyroid eye disease. Don't blink. Okay, blink. But don't touch that now. Stay tuned to Eyes on the Road to get all the details, eye-opening details. Of course, if you're a returning listener, you know it's time for the show. But for those joining us for the very first time, welcome. You're tuned into Eyes on the Road, the program that examines one of your most delicate and vital organs. I'm talking about your eyes, if you're still trying to guess. And this show is brought to you by Lagos Traffic Radio 96.1 FM. Welcome, my name is Akan Hussein. Okay, so last week we gave you free consultations on all eye-related topics. Of course, it was open day. Dr. Priscilia Imade and Dr. Aruna Rashidat answered all eye-related questions. This week, it's a new topic, like I gave you that background info earlier, thyroid eye disease. Thyroid eye disease is an autoimmune inflammatory disorder that affects the tissues around the eyes, causing inflammation and swelling. It's caused by problems with the thyroid gland or hyperthyroidism. Okay, for those who did a bit of biology in secondary school, I'm sure you've come across this. The symptoms include bulging eyes, redness, blurry, and double vision. And today we'll be looking at what causes this, how to diagnose, the treatment and prevention. So let's go together as we get to know what exactly this is and ways to manage or prevent this condition. Now, shining the light on this topic is none other than Dr. Priscilia Imade, Doctor of Optometry with a PhD in Public Health and a consultant optometrist at Modern Eye Care Foundation, situated at Omoli, Ujodebaja, Lagos. Yes, and of course, a serial fellow, both of the American Optometrists Society. Did I get that correctly? Academy of Optometry and the Nigerian Optometrists Association. So it's a double header. Yes, indeed. Welcome, Doctor. Good afternoon.
Thank you very much, Akan.
And yes, we did not put this in the script.
The script, I got
that you got an award
last week.
2024 is your year.
Honestly,
tell us about that. Tell us about that award.
Just from the beginning of the year, I celebrated my birthday.
Yes. You launched your book. Yeah.
From there, I went on to get the fellowship of the Nigerian Optometric Association.
Same year.
I got some other awards alongside anyway, and then down American Academy of Optometry, and then the Nigerian Achievers Award for contributing to the field of optometry.
Wow.
In Nigeria.
In 1 year.
In 1 year.
Amazing.
It can only be God.
It can only get better.
I'm so grateful to Baba God. Thank you, all my listeners, for encouraging me.
Of course.
Thank you.
All right, Doctor.
Yes, so today we are talking about thyroid eye disease. You know why I chose this topic?
Why?
Oh, have I told my listeners Happy New Month? I think I have. It's a new month, and it's a Yuletide month as well. So there's a lot in stock that we're going to discuss in this month.
The last of the Ember months.
Exactly. We've been driving safe.
Indeed.
So that's good news. So thyroid eye disease, I just want to throw some light on it this afternoon because statistics have shown that in Nigeria, we really don't know that such a problem exists. The awareness is low, and even for those that know, they are also aware that it can affect the eye. You see, just like diabetes can affect your eyes, hypertension affects your eyes. Same thing with thyroid disorders or thyroid eye disease. For thyroid, it's just a hormone that is produced, by the body, and any disorder in that hormone can actually affect your vision. And because people ordinarily will not even screen for such thyroid disorders, they may not even know that they have it until maybe it's really manifest. Sometimes some people can see like a goiter on the neck and things like that. Sometimes it may not manifest. It may not be as bulgy as that, but the disorders could be just within, and it can be affecting other organs in the body because it's an autoimmune disease. And it's very common amongst women between the age of 30 to 50, because it's hormone related.
Okay.
So if you are within that age bracket, we normally encourage you to add, thyroid hormone test or thyroid gland testing to part of your medical routine. You see, we also encourage everyone on this program to at least once a year have a general medical checkup. So you should be adding that to the, the examination that you'll be doing. You may have to do some blood work, like testing your lipid profile, your thyroid profile, which we have just talked about now, and every other organ in your body. Because sometimes some of the things that may be causing you your eye problems are things you may not even know or pay attention to. But now statistics is showing that thyroid eye disease is becoming very prevalent in Nigeria, and there are quite a number of reasons for that. Our diet, things we do, so many things around us, it's just causing aging is also a major factor, that can result in that. So for people who have thyroid eye disease, how would you know that there is a problem with your eye that is caused by the thyroid? Number one, you could find them having bulging eyes.
Bulging eyes.
If you are a man or a woman, suddenly you notice that your eyes are getting bigger.
When it's bigger than it's supposed to look like.
You just notice that the size of your eyeball. We are not talking about the head now. We are not talking about your lids and lashes. We are talking about the eyeball itself. If you notice that it's really getting bigger or it's protruding, some people have natural, bulgy eyes, big eyes, what we call polo eye here. But then that's not the one we are saying. That's not the one we are saying. But you just notice that it's like my eyes are now, getting wider. Or some people, discover that when they are sleeping, the two lids, the upper eyelid and the lower eyelid, will no longer join together, will no longer close. So you could start suspecting a thyroid problem. And then for people also who constantly their eyes are red, redness of the eyes, another hallmark, you just discover that your eye used to be white, but after a while, the eye was just changing, and now it's like, permanently brown or, red.
Wow.
Once you notice that, you should come for an eye examination. It could be a thyroid problem that is making your eyes red. People who have thyroid issues will also experience a problem we call dry eye problems. You just, the tears in your eyes can start drying out or evaporating out, because the hormones in your body have been affected, especially the thyroid hormones. Also, you may feel pain in the eye every time when you close your eyes, as if there is pepper, they pour pepper in your eye. You just feel pain. You close your eyes, there's pepper. You open your eye, there's pepper. Sometimes you have to be rubbing the eye to get some comfort.
You're literally saying pepper.
In addition with
moving on.
Anyway, so then discomfort. Sometimes the discomfort you are feeling in your eye, you can't even explain it. There's this kind of feeling, you will just be experiencing your eye. You don't know where to place it.
Yes.
You cannot say this is exactly the problem. You cannot say it's scratching me. You cannot say it's paining me. You cannot, you just know that there is a discomfort, a general discomfort that there is no language to explain it. It could be that you are having, symptoms for this thyroid eye disease, especially if you are a woman. So there will be need to come for eye examination. There's swelling. you just discover that your eyes swell. For some people, they sleep, wake up, the eyes swell. Sometimes it will go down. Before you know it, it will swell again. And all those fluctuations, please come for eye examination. And then people, they also experience what we call double vision. You start seeing things as double. As I'm looking at my presenter anchor, I can be seeing him as two if there is a thyroid problem.
Like trees.
You see, so double or blurry vision can also be an indication that one may be developing a thyroid eye disease.
Okay.
And then you just discover also that the eyes are now just wide open in the day.
When is it open?
You upper eyelid, the space within your eye that we use and saying that open space may become wider. So you just discover that your eyes are now open, and as a result of this, you can start having ptosis.
Okay.
You may even start having lag in the eyelids, or there could be ectropion, entropion. That's you can start having issues with your eyelids.
So doctor,
photophobia.
let me call back a bit. So ptosis, because of those who might not have an idea.
I just said it.
Yes.
Ptosis can be a lag of the upper eyelids. It will now, just
so that those people that have their eyelids look
as
like
if
they're
it's almost drooping.
as if
As if it's almost closing, they can't open.
Okay.
Things like that can happen. You can start having abnormalities of the eyelids.
Okay.
It can also be associated with this condition that we are talking about. And generally, the things that will cause thyroid, the major culprit is genetics.
Oh, okay.
It can be inherited. So these are reasons why we should be checking our eyes. Sometimes you may not even know that your parents or grandparents had it because you did not grow up to meet them, or maybe there was no history. They may not have even done an eye examination. That's why you must screen. All these diseases, it's good to just screen for them to rule them out. And then it can also be as a result of thyroid dysfunction, like we have said earlier. For women too, during pregnancy, it can also result in hormonal fluctuations, and then it can be pregnancy induced. Not in every woman, but for some women. And of course, inflammation. And then it's an autoimmune disease. By that we mean that sometimes we may not even really be able to explain what is causing it. It just occurs on its own. So that's why it's very proper that before this year ends, try to do a general eye test, and then you can screen for all these ailments. If not that Nigerians will complain too much about no money to eat. General medical checkup is just something you do. It's not because you are sick.
Yes.
You just want to know your state of health. So all these tests, you just do them, you just run them, and then you are sure you are good. So what are risk factors for developing thyroid eye disease?
All right.
Predominantly among them is poorly managed hyperthyroidism. That's when the thyroid hormone in the body is overactive, producing more than is expected.
So you can actually have too much thyroid
or less. Yes, you can have hypothyroidism or hyper, just like you have hypertension or hypotension. If it's hyper, HYPER, that means over. That's just what it means. And also risk factors, gender. Women are more affected, like we said, and then anybody or any woman between the age of 30 to 50 is more at risk. It's not as if it does not affect men. Men too can also have it, but it's just that that's the highest risk factor is around that for women. And of course, family history, which also have to do with genetics. And then people who smoke, men who smoke too are more predisposed to smoke. Men who smoke would have hyperthyroidism to contend with,
so
or thyroid eye disease to contend with if they already have the disease.
Okay.
Is if they already have the disease. Smoking is a risk factor that will make the person develop thyroid eye disease or make the disease to get worse. Other autoimmune diseases can also complicate it, like rheumatoid arthritis, lupus, even John Green syndrome, and other type of autoimmune diseases. They can co-occur. So that's a major reason too. You should have your eyes checked. And then, of course, diabetes, especially type 1 diabetes. People who have it can also have this thyroid eye disease. And already we have said that hormonal changes, especially when it occurs in pregnancy, then you can start having that. So there was
the one that happens in pregnancy. Is it permanent, or does it?
well, for some people after pregnancy it goes down.
back.
Why for some, for some reason we can't explain. You just have to. It becomes more or less like a recurring disease or permanent, and then you just have to keep treating. That's why in pregnancy you go for your pregnancy test at different trimesters, and then you run series of tests. They just want to be sure that everything is okay and it's well. But I think we need to worry now because diseases are wearing so common amongst us. Yes, are not becoming rampant and predominant.
But why is that? Why is that, doctor?
A lot of changes. There are intercultural activities going on, and many of us, blacks, travel out. Gene mutations are also happening, and then genetics and things like that. But generally, if we are just a bit careful, we'll just be able to surmount some of this. Like in my clinic these days, I just discovered that people with thyroid eye problems are becoming, I encounter them more now compared to before. And then, in my complex, we have a laboratory there, we have dental, and then there's the eye section as well.
Wow.
So by the time they do the laboratory test, just do the thyroid profile test, you discover that their levels are, well out of normal, and they may not even know. Some of them, they don't even have symptoms, or they have symptoms, they don't even know that that's where it's coming from. Like I said earlier, that many people, until they see a bulge, that's
coming out,
that's when they start saying, that something is happening. Meanwhile, it's already been there before it protruded out. A lot of changes. Damages have already happened.
All right, a quick look at the traffic situation at this time. For those coming in all the way from the 3rd Mainland Bridge, I see that it's still looking quite encouraging all the way through. For those trying to connect Bagada, quite good. And onwards, Ifako at this time, it's still quite a rapid movement, I can tell you that. Moving way, way smooth as against normally how it is at this time on other days. So movement inwards, the Ogudu end. We'll confirm that. But at this time, onwards journey, Ifako is looking good. Other parts of town, the Lezik end, coming all the way from the Ikeja overpass, things are looking good. On the bridge, a little cluttered. Yes, we have a lot of vehicles, cluttered there on the bridge. But beyond that, and it's quite free connecting Lezik at this time. We're talking thyroid eye disease, and Dr. Priscilia Imade has been taking us to the classroom, giving us the expert knowledge about what this is all about. If you have any question, feel free to connect. This is the time. I know you definitely have seen someone with any of these symptoms that Dr. Priscilia Imade mentioned, so feel free to connect. You can call 091. I assure you that will go through. 091 538 77127. That is 091 538 77127. I'd love to hear from you. Do call in before we end the show. All right, back to you, doctor.
Okay, let's quickly look at the management. Or even how do we even diagnose it in a clinic when you come for eye examination? That's why I keep saying on this program, eye test is more than just getting glasses. If you come to my clinic, for example, we don't just test you for glasses. We do what is called a comprehensive eye examination. So you
can actually come and go without needing glasses.
Someone can just walk in and just check. So I need glasses to read, and then they just check your eyes, because there are different structures in the eye that control these functions that we are talking about. Each structure has its function. So if you just come in for only just glasses, within 5, 10, 20 minutes you are done. But if you are doing a comprehensive eye examination, like what we do in my clinic, we take our time to examine the structures in your eye layer by layer. We look at it from the anterior part to the posterior part, even as far as checking the connection between your eye and your brain.
Wow.
Because the eye is the externalized part of the brain.
You have things to check that.
Yes, you have machines that will help us, to check all those ones.
And that's
there are some people that have tumor that we have detected.
Is there a special cause for that?
I can. Leave that one. Come and check your eyes. That's what we are saying. Do a comprehensive eye examination.
Right.
Well, it may cost you a bit more than the regular eye test, but you know how many lives we have saved that because they did comprehensive tests, we're able to detect some things that are happening. You know, the eye is the externalized, part of the brain, and then the eye is the window to the body. When you have malaria, you visit your doctor. Don't you open the eye and they are looking. Why are they looking at it? Because everything happening in your body can show through your eyes. So when you come to my clinic, I will not just say, oh yeah, let me just check you for glasses. Okay, what number do you need to read or whatever? No, I don't do that. I'm more than that. I can, but now you should also know that I'm a fellow of the American Academy of Optometry. So we are practicing international standards. We are bringing them home here. You don't even have to go there. The standard they here.
What you printed the thing big? Let them see it as they come into your.
Unfortunately, I didn't even do that. Okay, now that you said it, I will do it.
They have to know.
So that's just it. So in testing the eyes, we are able to check many of these myriads of problems. So please, I'm using this opportunity to talk to everyone listening to me out there that when you go for eye examination, don't just hinge on checking glasses. No. Eye examination is more than glasses. Glasses is just a small aspect of the eyes. There are other things that should be checked. So for the management of thyroid eye disease, what generally we do first is to monitor your thyroid gland and then try to regulate the disorders that you will do with your physician or your medical doctor. And then, of course, you should be having your regular thyroid function test to know what levels and if they are okay. If you are somebody that smokes, you must stop smoking. We are not saying reduce. You have to stop smoking, and you also have to stop alcohol. And then you must avoid triggers.
Triggers? What do you
yes, because
triggers?
sometimes you may not be a smoker, but you might be staying where people are smoking, and then you become a second-hand smoker. I've had patients like that will tell me, I don't smoke.
I was told it's worse than.
Yes, but my friends smoke, and we are always together. You know, that kind of a thing. It's going to affect your eyes. Those are triggers. And then, sometimes too, when you are always in a lighted environment where there is light, a lot of light, it can also induce photophobia on the eye. You may have to, reduce that. People who are also prone to dust and irritants, chemicals that can irritate the eye and make you, start having inflammatory reactions. You may also have to avoid such triggers. And then you must always wear protective eyeglasses. For people who have thyroid eye disease, we give them special glasses to wear that will have protection from the sun, from wind, from dust, from computer, from phone, such that those irritating factors or triggers can be reduced to the barest minimum. And of course, we encourage regular eye examination. When we say regular, we mean every appointment you are given, you have to keep to it. And then timely eye examination as well. If we say every year, you should be checking your eyes. We mean every year. And then you must not wait until the problem deteriorates before you come. Coming early to the clinic will give us a better prognosis. So it must be regular, and of course it must be timely. And if we do all that, sometimes for some people, surgery could be recommended. And then there are drugs or medications as well that can be also recommended for the management of thyroid eye disease. But the baseline is to ensure that manage that your thyroid hormone level very, very well. There are medications, to correct that. The physicians know the best thing to do as far as that is concerned. But the one that concerns the eye, when you come to us, we also know what to do. And we generally encourage people that if you have been diagnosed of thyroid disorders, you must be doing corresponding eye examinations.
Corresponding eye examinations. Okay. So anyone who has maybe the goiter should always also get to check the eyes.
You have to check your eyes because if you don't, a lot of damages could be happening. Now there was a case I saw. We can't just mention here, but we can give the example because our patient records are private. There was a case of this lady that came to us. She had serious disorders. It wasn't even as prominent on her neck, but she was kind enough to have done a test and noticed that her levels were always, thyroid levels were always high. In addition, she had diabetes.
Oh, wow.
Yes, people who have diabetes too. And we said earlier that diabetes is also another risk factor. So all these things should be checked. By the time we checked her eyes, we now saw that because there was diabetes superimposed with the thyroid problem, there was already what we call dot and blood hemorrhages at the back of her eyes. And then when we check the connection also between the eye and the brain, we can use the slit lamp actually to check what we call the optic nerve head, which actually gives us an impression of what could be happening inside the eye or even up to the brain, the external part of it that we can see that is related to the eye. So we discovered that there were a lot of damages going on there. Even when we looked at the macular area, macula in the eye, we have talked about that at some point. We talked about age-related macular degenerations. Yeah. We also noticed too that there are damages, in these places. And if you just come to the eye clinic, you say, I want to just check for glasses, nobody will check those ones for you. Yes. They just come, they just give you something to read, and then you read and you go. But these ones will have to take time and then look through very well to be sure that the posterior part of the eyes, they are okay. Just realize that this woman already was having damages at the back of the eye. If she had not come on time, we would not have been able to know. And then you find out that some people, they will now get blind. They will not say it's one witch or one wizard that caused it. Meanwhile, it's because they did not come on time to the clinic. The diagnosis was not made early and on time, and so treatments couldn't be as effective as it should be. In fact, even today, there was another case I saw before I came, a 67-year-old patient who told me that in the last 5 to 10 years, she has not done eye tests. And by the time we checked the eye, discovered that already one eye already had what we call diabetic cataract. The other eye had the glaucoma. The 2 eyes had glaucoma. One was already worse, and she didn't know. That all those she don't notice that her vision was just reducing. And then she just said, okay, finally, let me just go and check. Wow. So these are some of the things we are saying, and that's why we are on this program, giving information that early diagnosis will give you a better prognosis.
Thank you so much, Dr. Priscilia Imade. It's been an amazing time on the show. Elder Tawagbade, well, we have run out of time. I might not be able to pick your call, but of course we can take your call next week. Thank you so much for trying to call, but you actually dialed in at the last minute, so we might not be able to do that. Eye health is important to improve the quality of your life, and because we love your eyes, we bring this show to you. Your feedback on topics discussed on the show helps us serve you better. So please do me one favor, keep them coming because they're highly appreciated. Our regular optometrist on the show, Dr. Priscilia Imade, OD, MSc, PhD in public health, consultant optometrist at Modern Eye Care Foundation, can be reached via her phone line 080 33336672. That is 080 3333 6672. And the address of the clinic, yes, Modern Eye Care Foundation, is spelled 16 to 18 Ogunlusi Road, opposite Omole Estate, Phase 1 by Akeode Bus Stop, Ojodu Baja. On behalf of the production team led by Micah Arwacha, assisted by Juan Irabo, and also not forgetting Benita Olame, and also to our executive producer Tayo Akoli. My name is Akan Usen. Safe travels to your destinations. See you next week. Bye for now.
It's a crazy world. A whole lot of madness, chaos. Just need a better place. Can't you see that I just want a better world? Don't you think it's odd to be crying over? You see no colors, not the goal. Let's not talk. You honor me, I honor you. Don't let religion divide us all.